everyone, so let's move towards our today's topic, which is
there are muscles which are helping in the movement of the larynx and the vocal cord as well. Now there are 7 muscles of the larynx, and we will discuss one by one. First of all, the first muscle is cricothyroid muscle. Now the name indicates that it is originating from cricoid cricoid cartilage, and insertion is in the thyroid cartilage. Okay, this muscle helps in the process of phonation. Okay, phonation is the process of voice production. तो voice production की में बड़ा help करता है because they will help in the movement of vocal cords as well. Now the second muscle is posterior cricothyroid muscle. As the name indicates, it will arise from the cricoid and insert in the arytenoid muscle, and it will arise from the posterior side of the cricoid cartilage. Okay, and this muscle is also known as safest or safety muscle of the larynx. Now this muscle will help in abduction, abduction, abduction of the vocal cords, or in other words you can also say that the opening of the rami glottis. Now what is rami glottis? What is abduction? आपको पता है vocal cord दोनों साइड पे foldings होती है mucous membrane की inside the cavity of the larynx. Okay, now when they come together they will called as adduction. If they move apart, if they move away, or if they move laterally, they will called as abduction. Okay, now if they move away, the space between the vocal cord, which is called as rami glottis, will increase. That means there will be an opening of the space called as rami glottis when there will be abduction of the vocal cords. If we talk about lateral cricoid arytenoid muscle, so this muscle help in adduction. Okay, due to which the vocal cords come together and the size and the space between the vocal cord, that is rami glottis, will decrease, called as closing of the rami glottis. Okay, so you have to remember. Now the fourth muscle is transverse arytenoid muscle. Lateral cricoarytenoid muscle is originating from the lateral side of the cricoid bone, and insertion is in the arytenoid muscle. The transverse arytenoid muscle is originating from one arytenoid cartilage to the other arytenoid cartilage. As you know that arytenoid cartilage are paired cartilage. Okay, so one side to another side they will move and their fibers will move, and this is called as transverse arytenoid muscle, and they will also help in adduction of the vocal cord, or in other words the closing of the rami glottis. Now oblique arytenoid muscle. Oblique arytenoid muscle, basically they are 2 in number, they are paired muscle, and they also help in adduction of the vocal cords. Okay, adduction means closing of the rami glottis. So in the adduction of the vocal cords, 3 muscles are involved: lateral cricothyroid muscle, lateral cricoarytenoid muscle, transverse arytenoid muscle, and oblique arytenoid muscle. Okay, and from this oblique arytenoid muscle, some fibers will arise and they will attach with the epiglottis and called as aryepiglottic muscle. So you have to remember this point as well. Now oblique arytenoid muscle is also arising from one arytenoid muscle from one arytenoid cartilage to the other arytenoid cartilage, same like transverse arytenoid muscle. Now the second last muscle is thyroarytenoid muscle. It is arising from the thyroid cartilage and insertion is in the arytenoid cartilage. Thyroarytenoid muscle are also paired muscle, and they will help in relaxing the vocal cord. In the relaxation of the vocal cord, 2 muscles are involved. One is thyroarytenoid muscle, and the second one we will gonna talk after this muscle. Now same like oblique arytenoid muscle, in the thyroarytenoid muscle, few fibers will arise and they will gonna insert, they will gonna attach with the epiglottis, due to which that muscle, बेसिकली जो थायरो एपिग्लॉटिक मसल है इसको थायरो एपिग्लॉटिक मसल कहेंगे. और जो मैंने आपको पहले बताया एरी एपिग्लॉटिक मसल, दीज टू मसल्स आर नॉट इंक्लूडेड इन द मसल्स ऑफ द लैरिंक्स. बट आपको इसलिए बता रहा हूँ कि कभी कभार ये पूछ लिए जाते हैं, ये होते हैं बट दे आर नॉट इंक्लूडेड इन द मसल्स ऑफ द लैरिंक्स. Okay, if someone ask you कि what are the muscles of how muscles or which muscles are present in the larynx, so you will say there are 7 muscles in the larynx. But if someone asks you that what is thyroepiglottic muscle and or epiglottic muscle, so you have to know that क्या होते हैं. ठीक है, बेसिकली थायरोएपिग्लॉटिक मसल थायरोएरिटेनॉइड मसल से अराइज होते हैं, वहाँ से फाइबर्स अराइज होते हैं. और एरी एपिग्लॉटिक मसल एरिटेनॉइड ऑब्लिक एरिटेनॉइड मसल के मसल से अराइज होते हैं कुछ फाइबर्स. ठीक है. नाउ द लास्ट मसल इज वोकैलिस मसल. दिस मसल इज ऑल्सो हेल्प इन द रिलैक्सिंग द वोकल कॉर्ड. ओके, सो जब मूवमेंट होती है वोकल कॉर्ड की, इंस्पायरेशन इनहेलेशन, तो दे विल गोना हेल्प. ओके, वन मोर पॉइंट यू हैव टू रिमेंबर, the thyroepiglottic muscle and epiglottic muscle. The thyroepiglottic muscle will will function, will help in the opening of the inlet of the larynx, opening of the cavity of the larynx. ठीक है, जब larynx की cavity खुली हुई है that means thyroepiglottic muscle काम कर रहे हैं. अगर वो बंद है तो that means एरी एपिग्लॉटिक मसल काम कर रहे हैं. So this was the whole topic you have to remember. Till then, work hard, study hard, and good luck. Bye.